Hi, my name is Frances Villatria, and I am excited to share my internship experience at Mercy McMahon Terrace, known as MMT. MMT is a nonprofit, faith-based long-term care facility located in Sacramento, California. And my internship is titled The Evaluation of Musculoskeletal Injury Prevention Program for Resident Care Aides in Long-Term Care. Mercy McMahon Terrace, their mission is to provide compassionate, high-quality care for elderly residents needing daily assistance. And the organization is led by an administrator and director of nursing that is supported by a care team that includes resident care aides or RCAs. As a graduate intern, my main role was to focus on injury prevention, especially preventing low back musculoskeletal injuries in RCAs. RCAs are at a high risk due to the physical nature of their jobs, and they are highly susceptible to such injuries due to the repetitive lifting, transfers, and bending required in their duties. And I developed two deliverables throughout my internship, and those are a literature review and an injury prevention manual for RCAs. I completed this by assessing and researching peer-reviewed articles and supporting the prevention of low back musculoskeletal injuries amongst RCAs. And I identified several key tasks, such as conducting a literature review on injury prevention strategies and analyzed data from peer-reviewed articles, and developed an injury prevention manual for RCAs with practical injury prevention tools. These were implemented in a phased approach, which includes research and data collection based on the research from the peer-reviewed articles and ensuring that these findings are in alignment with the agency goals and mission statement. I used a structured, evidence-based approach, conducting the literature review using databases like Google Scholar to identify peer-reviewed articles and reviewed the Occupational Safety and Health Administration and the National Institute of Occupational Safety and Health guidelines for ergonomic safety and body mechanics. All of the tasks were coordinated by me. I organized my work in phases: research, data collection, and drafting. And through the literature review, I developed an injury prevention manual for RCAs to use throughout their shift and for training. And it's tailored to the specific needs and capabilities of the RCAs at MMT. And I used the theories such as the health belief model to inform training strategies and promote behavior change. And as you can see on the right-hand side of the slide, there is a small snippet of what is to be included in the injury prevention manual. And that is just a quick glance to prevent an injury of low back musculoskeletal. And that word is SAFE, and it stands for scanning, adjust, follow through, and an evaluation. On a day-to-day basis, my responsibilities at MMT was a balance of research and application. Much of my time was spent reviewing injury data and exploring a wide range of preventative intervention methods aimed at reducing musculoskeletal back injuries in resident care staff. These injuries are not only common, but they are preventable. And I wanted to understand what strategies had the most evidence behind them. I analyzed various public health interventions used in other long-term care settings, hospitals, and in workplace health programs. These included ergonomic training programs to teach proper body mechanics, assistive devices such as gait belts and mechanical lifts, and proper body mechanics, and a team-based lifting protocols that reduced individual strain. It also highlighted gaps in implementation and sustainability within non-hospital long-term care environments. The analysis became the core of the literature review I produced. The review not only evaluated each strategy's effectiveness, but it also addressed the challenges in implementation, especially in a non-hospital setting where resources, staffing, and time are often limited. And one key insight from the literature review was that even when best practices are known, sustainability is often the weak link. And depending on the agency or department, training happens once or it can happen annually. But without reinforcement, habits do regress. That insight really shaped the second major deliverable of my internship, the Injury Prevention Manual. The manual was designed with busy frontline staff in mind. I prioritized visual aids and step-by-step body mechanic instructions to make information easy to absorb on the fly, quick tips for safe lifting, self-check questions, and daily stretch routines to build awareness, and user-friendly checklists that workers could reference during training or team huddles. And I focused on practicality and ease of use during RCA's busy shifts, and this will be distributed as an on-site training supplement. So from conducting the literature review on preventing low musculoskeletal injuries among resident care aides in long-term care facilities, I gained valuable insights into the high prevalence of these injuries due to the repetitive lifting, awkward postures, and prolonged physical demands. The research emphasized the importance of ergonomic interventions such as proper body mechanics training, use of mechanical lifting devices, and regular staff education on safe handling techniques. I also learned that organizational support, including staffing levels and a culture of safety, plays a crucial role in injury prevention. These findings significantly influenced my work in developing the Injury Prevention Manual by guiding the inclusion of practical strategies, evidence-based best practices, and policy recommendations tailored to the tasks and challenges care aides face in long-term care settings. And my goal was to create something that's not just informative, but actually usable in the fast-paced, high-stressed environment of long-term care. The manual will be available for distribution on site and can be integrated into future staff training programs. And on this slide, I have both of my deliverables, the literature review and the injury prevention manual, with the competencies that I accomplished throughout my internship and at the end of my deliverables. And each deliverable has two foundational competencies and one concentration competency. And that concentration is based on the health promotion behavioral health path of this course. And so this work directly reflects a core public health concern, the occupational safety and well-being of frontline caregivers, especially in aging and under-resourced health systems like long-term care facilities. RCAs are essential to these systems, yet they face high rates of low back and musculoskeletal injuries due to the repetitive lifting, bending, and assisting residents with mobility. These injuries don't just impact the individual worker, but they also ripple across the system. They result in an increased healthcare cost, both from treatment and workers' compensation claims, decreased quality of life, since injured staff may be less able to assist residents effectively, and staffing shortages due to the time off, which puts more of a strain on remaining staff and affects resident safety. I did encounter several challenges during the project. First was finding localized data specific to musculoskeletal injuries among RCAs in California was difficult. Much of the available literature focused on nurses or broader healthcare populations. So I had to gather and extract information from national trends and pair that with the information that I'm getting from the literature review. Second, there's often a disconnect between the best practices that was recommended in literature reviews, such as expensive equipment or frequent in-service training, and what's realistically feasible in a long-term care setting with limited funding and staff time. they may not be able to get that expensive equipment or get that frequent in-service trainings. And yet, despite those challenges, I met my core objectives. The literature review was completed and shared with the agency leadership, and the manual was developed in collaboration with frontline staff in mind. While a formal evaluation of the manual's impact wasn't possible due to the time constraints, the materials will be available for the agency to integrate into future training. The next steps may include using this manual during onboarding and possibly collecting feedback in the next training cycle to assess its effectiveness. So even though the project was short term, it's designed to have a lasting practical impact. In conclusion, this internship was incredibly rewarding. I had the chance to apply public health theory in real and meaningful way. I learned that I'm adaptable, a good communicator, and passionate about creating tools that people will actually use. I learned I love the hands-on side of public health, and it's not enough to be evidence-based. You also have to be context aware. Public health solutions only work when they fit the people and systems they serve. The literature review and manual are tools that MMT can continue to use in staff training, helping to protect their workers and improve quality of care long term. I gained the experience in translating research into actionable tools for public health practice, the flexibility and adaptability when working in a fast-paced clinical environment and communicating technical information in simple and empowering language. Small-scale interventions, when grounded in evidence and adapted to local realities, can make a lasting difference and impact not only to the department or agency, but for the RCAs. Public health and practice is about bridging the gap between theory and reality. Evidence-based strategies are essential. They must be tailored to the unique context and constraints of the community or organization. And these two deliverables serve as a foundational tool for future staff training and injury prevention at MMT. It is focused on practical and ease of understanding, and the work supports the agency's mission by helping protect the workforce, reducing injury-related absences, and promoting a safer care environment for both staff and residents. Thank you.